So what exactly are multiple chronic conditions? Hello, I'm Dr. Kim Keebler. I'm the director and founder of Multiple Chronic Conditions Resource Center. I have held multiple state and federal appointments. I'm an award-winning author, editor, and researcher, and a practicing clinician for over 38 years. Multiple chronic conditions include two or more chronic conditions at the same time. According to the Centers for Disease Control and Prevention in 2019, 1 in 4 Americans has a multiple chronic condition. And currently, 3 out of 4 Americans aged 65 and older or part of the Medicare beneficiary group of patients have more than 2 chronic conditions at any given time. Multiple chronic conditions last a year or more and require ongoing medical attention. They limit activities of daily living, and that reduces a patient's or person's quality of life. If we look at the history of multiple chronic conditions initiatives in the United States, in 2008, the U.S. Department of Health and Human Services Assistant Secretary of Health charged the departmental work group to identify Health and Human Services options for improving the health of persons with multiple chronic conditions in the United States. In 2009, the first published inventory included over 500 programs and initiatives and activities across the U.S. Department of Health and Human Services that were focused on improving the care and management of this patient population. In 2010, the Federal Register invited review and comments to the Multiple Chronic Conditions Strategic Framework, and at that time they received over 250 comments that were reviewed, and they used that information to help to develop the strategic framework in 2010 on multiple chronic conditions. This framework served as a comprehensive roadmap to improve the care of Americans with multiple chronic conditions. This provided an open conference call with over 400 participants who contributed to the ideas and comments to the Multiple Chronic Condition Initiative. In 2010, not only did the Patient Protection and Affordable Care Act get passed, but Title IV of the Care Act included prevention of chronic disease and improving public health, a priority to the federal approach to healthcare in the United States. In 2012, the U.S. Department of Health and Human Services identified private sector activities focused on improving the health of individuals with multiple chronic conditions. This included 15 innovative profiles, many of which were funded through the Centers of Medicare and Medicaid Innovation projects. In 2013, the Agency for Healthcare Research and Quality identified the multiple chronic conditions resources for healthcare professionals and the public and established a multiple chronic conditions resource center. In 2007 through 2015, the Centers of Medicare and Medicaid Services identified Medicare fee-for-service beneficiaries, looking at information, products, and analytics, examining chronic conditions, and producing chart books that looked at combinations or clusters of disease and cost of care. In 2015, the U.S. Department of Health and Human Services Multiple Chronic Conditions identified and developed a framework for education and training that was interdisciplinary in nature and used to provide a curriculum to all healthcare professionals in the United States caring for patients with more than 2 chronic conditions at any given time. In 2015, the Department of Health and Human Services and the Centers for Medicare and Medicaid Services initiated the Chronic Care Management Incentive for primary care providers who care for patients with 2 or more chronic conditions with the expectations that they may decease within a year. This incentive provides 24/7 access to the primary care provider for these patients to ensure coordinated, comprehensive, and cost-effective care for this patient population. In 2016, the National Institute for Healthcare Excellence, Multimorbidity Clinical Assessment and Management, was established by the Agency for Healthcare Research and Quality and included the National Guideline Clearinghouse, which has since been dissolved as a result of lack of funding. In 2019, the Agency for Healthcare Research and Quality resurrected the multiple chronic conditions initiatives and identified it as one of the top 3 U.S. healthcare priorities, giving the demographics of the largest, fastest growing, and costliest patient population in the United States. Currently, in the United States, the most common causes of death include heart disease, cancer, accidents or unintentional injuries, primarily a result of opiate deaths and medical mistakes, chronic lower respiratory diseases such as chronic obstructive pulmonary disease, stroke, Alzheimer's disease, diabetes, influenza, pneumonia, nephritis, nephrotic syndrome and nephrosis, and intentional self-harm or suicide. If we look at the last chart book from Centers of Medicare and Medicaid, which was published in 2010, this is looking at multiple diseases that came out of fee-for-service evaluation or analytics on patients with Medicare. If you see here that the majority of patients have 4 to 5 concomitant conditions at any given time. And if we think about having concomitant chronic conditions and the associated symptomatology, if the symptoms are not well understood or prevented or managed, this will increase the disease to be exacerbated and often takes a patient into hospital, promoting a decline in physical functioning, increasing the decline and progression of disease and disability by being in hospital and being deconditioned. The most important aspect of the patient, the family, the healthcare provider, and the healthcare team is to understand how to prevent disease exacerbations, reduce the symptoms, and prevent the worsening of disease, and promoting optimal quality of life.